chemical pregnancy. Do you people know that there is something called chemical pregnancy? Most ladies do not even know that they usually have chemical pregnancy without even knowing. Now, chemical pregnancy is a loss of pregnancy before even the ultrasound will detect that you're pregnant. This pregnancy is gone already. Most ladies have chemical pregnancy without them knowing. Sometimes it happens just a week before their menstruation, okay? You notice sometimes you can go for a pregnancy test and you tested positive. In the next 1 or 2 days, you're seeing, like, you tell yourself that you're menstruating. That is not menstruation. You just had a chemical pregnancy, okay? Chemical pregnancy is a pregnancy that loss of pregnancy within 5 weeks. Before the ultrasound, we even detected that there is a fetal sac there, the pregnancy is gone. Okay, you can go for a pregnancy test. It can be detected through strip, like when you use a strip to test for a pregnancy test with blood. It will say positive that you are pregnant. But when you go for an ultrasound, nothing will be seen. The scan cannot see any fetal sac. Okay, and within 1 or 2 days, you notice that you are bleeding, and it comes like as if towards to your, some women experience it towards to their next menses, and so they will not even know that they were pregnant. And what is happening right now is chemical pregnancy. Somebody with chemical pregnancy can also get a normal pregnancy that can stay to term, but it depends on how you handled this chemical pregnancy. If you have frequently had chemical pregnancy, okay, what you have to do is you have to go to the hospital for doctor to detect the actual, you go to the hospital for the doctor to detect the actual cause of this chemical pregnancy so that it can be treated to prevent it from repeating itself, so you can have a normal pregnancy that can stay to term. So what are the causes of chemical pregnancy? It's mostly abnormal chromosomal abnormality. That is when you have an abnormal embryo problem, there is a problem with the sperm or the egg, okay? Another cause is uterine abnormality. There might be issue with your uterus, your reproductive organs as a female. That is another cause. Another cause is when the implantation of the fetus occurs outside the womb, okay, something like that causes chemical pregnancy. Another cause is when a woman has an infection like chlamydia and syphilis. That is another cause of a chemical pregnancy. Then abnormal hormone level, hormonal imbalance can cause chemical pregnancy, okay, and most times women with PCOS, okay, that is PCOS, can have chemical pregnancy. So if you notice you have had recurrent chemical pregnancy, please do not keep on. Like I told you, it's a loss of pregnancy before the ultrasound can even detect it. It occurs, this loss of pregnancy occurs within 5 weeks. It doesn't pass 5 weeks. You just notice that you went for a pregnancy test and the next 2 or 3 days you're bleeding. Is a chemical pregnancy. Okay, you just lost a pregnancy and it doesn't come with any symptoms. It's just like you just have your usual menstrual cramps. It will just happen to you like a message, like you want to menstruate, okay? And most times it comes towards the period you want to menstruate. So it's kind of confusing. When you have gone for a pregnancy test that shows positive and the next 2 or 3 days you're bleeding, know that you are having